Hey, good morning, everybody. This is Brittany Jennings with the Seniors Blue Book, and today we're coming to you live with Dr. Lamar from Coastal Orthopedics. Good morning, Dr. Lamar. How are you?
Good morning, Brittany. Thank you. I'm good. Thank you.
I'm super excited to have you here today, Dr. Lamar, to talk about sports medicine. And so let's talk a little bit about you, yourself personally, just your introduction and how you got into Coastal Orthopedics.
Yes, I'm a sports trained, subspecialized orthopedic surgeon. And my route to that went through Davidson College in North Carolina, where I played college football and was unfortunately, in the very cliche manner, injured my knee and was introduced then to the orthopedic surgeon for our team, who I came to respect, and he helped me a great deal. And I finished my career as captain of the team, and everything went very well for me. But it spawned an interest in sports medicine and orthopedics. So then I went to med school in South Florida, Tampa. I then trained in orthopedics at the University of Pennsylvania in Philadelphia for 5 years, and then did a subspecialty year in Miami at the University of Miami in Coral Gables. Again, specialized in arthroscopic techniques and the like. I had a great deal of exposure and training to degenerative conditions in my residency program, where I did beyond somewhere around 1,000 joint replacements. So I had a lot of experience there too. And then I was actually originally from this area. I played football at Manatee High School and started looking around for my career position, and had an opportunity to stay on with the Tampa Bay Buccaneers, who I was taking care of in my fellowship. And so that got me close. And therefore ended up back here in my hood, and pretty happy to be here.
Let's talk too about sports medicine in general. If we have people joining us that are watching, could you just kind of give us a quick overview of the specialty and explanation of that?
Well, sports medicine is pretty wide ranging. I mean, we're almost kind of the generalist of the subspecialists, because we touch almost all body parts in some capacity. But the specialty itself is really dedicated or most thoughtful as a surgeon in arthroscopic techniques. So things that allow us to do minimally invasive approaches to problems. And, every joint, effectively every joint in the musculoskeletal system can have a camera put into it and had a procedure done to it that's minimally invasive. So those techniques are highly specialized and have evolved a great deal. But the kind of general understanding of it is if you have an injury that happened or something got provoked or aggravated while you're doing something active, whether it's specifically a sport or something other than that, the field serve as team physicians and things of that nature.
So I think what's one really exciting thing about you, Dr. Lamar, is your affiliation to the community here locally, but also the professional team. So talk a little bit about which ones you're affiliated with and how that kind of works with you going out as a medical provider to football games and anything related to sports.
Yeah, sure. Well, as I had mentioned, I was lucky enough to be asked to stay on with the Bucs, the NFL team here in Tampa, and I served as one of their their orthopedic surgeons for a little over a decade, and then the head trainer there ended up at Tennessee with the Tennessee Titans and asked me to help him there, and I've now been with them for, I think this is my 5th season. So that works because it's so far away. There's a lot of virtual interfacing and looking at studies remotely. And then I help them on game days typically, and for various analysis through the year, to include sports combine, where we kind of evaluate all the potential talent and get ready for the draft and those types of things. In addition, locally, the Baltimore Orioles have a rehab facility here and a spring training facility and minor league kind of setup that allows us to provide some additional influence and help for them. And I've been working with them now for at least 5 or 6 years. And I was the team physician for the men's U.S. soccer team, men's national team, leading up to the World Cup. It was in Brazil, and that was fun. I took care of the men's Olympic team as well, and traveled a great deal with almost all of the soccer teams affiliated with the United States. And then finally, the Gatorade Sports Science Institute. I'm one of the medical directors within their program. So that's not a big asking, but it's kind of an interesting caveat to what I do. And then locally, having gone to Manatee, and I've been their team doctor for a very, very long time, and I cover some high school games, and we take care of basically all the teams in Manatee County for the most part, and Cardinal Mooney down in Sarasota. So we've got a lot of kind of community reach, and we try and provide our expertise to them, me and all my partners here at Coastal, to try and give back in that way to the community, make sure that these kids are getting taken care of appropriately.
So one thing I do want to ask is about knee injuries. And have you been seeing more knee injuries with kind of the past 9 months, 10 months of how, people that are at home more, they're outside more, maybe away from the gym? What has that been like over the last several months? Definitely
been a change in activity level and types of injuries that I see. So I feel like pickleball is kind of taking the world by storm right now in this region. And certainly I've seen my fair share of pickleball related injuries. It's certainly hot among a lot of my senior patients, but it's actually infiltrating down into the younger population too. So, but directly as it relates to, I think your question was about knee injuries. Knee injuries come in all shapes and sizes, and they can happen in just about every activity. Anytime you're changing directions or transitioning from high to low, from squatting or kneeling, you're certainly a bit at risk of having some form of a knee injury.
I do want to mention, you guys have spring 2022 is the plan. You guys have a new facility that's coming. Is that right?
That's right. Yeah. Yeah, we're pretty excited about that. We're transitioning our headquarters and kind of expanding our footprint, both clinically and through our surgical suites, to a facility just off the State Road 64, not too far from the interstate. It's been a project and something we've been working on for many years, as you can imagine. And it looks like it's going to be coming to fruition in 22. We feel like we have several locations, and we're consolidating a couple of them. Certainly, we'll still have our offices here at Lakewood Ranch, and we'll have a new office over on the west side of town as well. And then we'll be consolidating our State Road 64 office and our surgical facilities to this new site on a much bigger footprint. So yeah, really excited about that.
Awesome. And as that gets closer, we, of course, will post all the information about that, but that's super exciting. So congrats on that addition. And thank you so much for joining us today on Seniors Blue Book Live. This is a segment that is taking off this year and helping educate our seniors, caregivers, and just general community. So thank you, Dr. Lamar, for your time, and I hope you have a wonderful day.
Yeah, thank you. No problem. Appreciate the opportunity. Thanks.